So I hope everyone can hear us loud and clear. Thank you for joining us. So I was just introducing you a little bit, but I'll let you introduce yourself also and tell us who you are.
Okay, well, I'm just I'm just trying to find the right light. Okay, okay. So I'm Dr. Prabhjot, gastroenterologist, hepatologist, physician. I work in many different places, including Dr Rakhee. That's how I know her. And the easiest way to get in touch with me, I also have a blog. It's www.drprabhjot.com. That's you have to spell the word doctor. Just some free stuff for gastro-related things that patients kind of ask for, and I noticed that they do some things they're not supposed to. So it's educational and awareness. No subscription, no nothing whatsoever. Just a resource. But there we go, straight to the point. You want to talk about vaccines and gastro stuff?
Yes. So the reason I've got you on tonight is because I've been getting a lot of questions, gastro-related, liver-related, and all that. So my first question would be, are there any conditions where we should avoid or get further clearance from our gastroenterologist before we get the vaccine? I won't say avoid because I think most of the conditions we can actually get the vaccine, but are there any that we should be of concern to get a letter from our physician or our gastroenterologist that's taking care of us before we go and get the vaccine?
Okay, yeah, so basically if it's anything that's not straightforward, meaning something that's not diarrhea and vomiting, something that's not gastritis or reflux related, get a letter, because otherwise you're going to get turned away if they have doubt. The first thing is that Australia put it out there, liver disease, doesn't matter whether it's viral or not, most of the drugs are straightforward and you should have a vaccine, except if it's liver transplant. You need to have a 3-month gap after the transplant, then you can get the vaccine. But on the same note, liver transplant patients and anybody with cirrhosis, that means your liver is quite seriously damaged, you're high risk, so which means you need the vaccine. Don't avoid it. As to type of vaccine, really, the main thing about this when it comes to your liver, it really depends if you have had any allergies, because some drugs, they get allergies, have got same components in the vaccines, which Rakhee, you know all about, especially the PEG and all these sort of things, which is quite often drugs that we use anyway. But if you have no allergies, then with regards to the liver, you should. Unless there is also a caveat though, if you have cirrhosis and you're at risk of decompensation, that means you are on a knife's edge, then talk to your doctor. Don't assume anything. Don't even assume what I say will be true a month from now. Things change so fast.
Yes.
For now, that's how it is.
Okay. What about patients who've got, gastritis? I think half of our population in Malaysia with our diet has got some sort of gastritis, gastric problem, reflux issue. Are these patients, do you have any, should they be concerned about getting the vaccine?
Not about actually getting the vaccine, but you got to think back about why do you have these conditions in the first place. You're probably not living your life properly. You're pushing yourself too hard, not eating healthy, doing just bad habits, not on time. Malaysian food is all full of spice, oil, fats, sour stuff, which is all bad for you in that context. So on that same note, there is no specific diet to keep COVID away or to cure COVID, no matter what people say. The diets that people talk about are basically anti-inflammatory diets, which is kind of what goes on. So as I tell all my patients, just eat more plants. I don't want you to be vegetarian, just eat more plants. And that's the commonest thing that goes around. Say it all the time.
So Prabhjot telling us to be vegetarian now, that's interesting.
No. I eat my meat every day, but just eat more plants. It's not just fruit and veg, nuts, soya, all these things. Yeah, definitely.
All right. If you have gastritis, if you have some sort of reflux issue and all that, there's no contraindication to getting the vaccine. But what about inflammatory bowel disease?
Oh yeah, okay. So that's an interesting one. Now, I looked at the guidelines that, well, you sent me this morning about different societies in Malaysia contributing towards our national thing. And interestingly, there's nothing from gastroenterology. And this is important because though inflammatory bowel disease, which the commonest are ulcerative colitis and Crohn's, it's not as common as the Western society. It's rising very fast. And because it's an immune-mediated disease, meaning that your immune system's out of control, you need immune suppressants to get it in control. Now, as a broad coverage for this, anybody with inflammatory bowel disease must have the vaccine. They should have the vaccine. unless it's specific indication, which you have to tell your doctor about. With regards to the medicines you're on, this suppresses your immune system. So with regards to the COVID vaccine, now this is still new and developing, because some studies would say yes, some would say no, is that it may decrease the effectiveness of the vaccine. That means you don't mount that much of a response, which means, are you that protected? That's the question. There's a lot of talk about having a different regime for people with inflammatory bowel disease, but as yet, nothing stands. Now, with that, what vaccines can you have if you have inflammatory bowel disease? Certainly, different countries say different thing. I know Indonesia has said that no such thing as Sinovac, and in fact, Pfizer only in specific cases. But in the UK, Moderna, Pfizer, AstraZeneca is all good. The Canadians take a different approach. So as you can see, I mean, I'm British trained, so I tend to follow that more and based on evidence. If you're not sure, you have to talk to your gastroenterologist, because you need to adjust. Now, immunosuppression can mean infliximab and heavy-duty medicines. The more you have on board, the more you have that risk. But even 20 milligrams of prednisolone for more than 1 month, that means every day, is immunosuppressing, which is quite easy to do for people on any, inflammatory bowel disease or any immunosuppressive therapy for whatever reason. And that's pretty much it. But apart from that, people with inflammatory bowel disease should have the vaccine. Don't run away from it.
So they definitely should get the vaccine, but what you're saying is the way the body responds to the vaccine may not be as normal as others. You might have a decreased response to the antibody production, right?
Yes.
Right.
Yes.
So what about procedures? Like if you go for a colonoscopy or an endoscopy, do I need to delay my vaccine if I've gone for a procedure? Like, do I need to be worried about the vaccine appointment date given, or is there any issues with that?
No, there isn't anything concrete about this, but there shouldn't be. It's the same risk for everything. If you had a colonoscopy on Plavix, when we have to stop it, then you stop it as per normal, and nothing else. I mean, if you do have sedation, of course I would say don't go for the vaccine on the same day or maybe the next day in case of any medication still running around your system. And most of the time, if people say you had any sort of other vaccines, I think you have to wait 7-8 days before you can have 2 weeks. There you go. So I would just apply that rule for any new introduction of medicines. Though this is just my point of view, and it's not by any consensus, particularly.
All right. So now, a popular question that I've been getting from a lot of my followers is, can I have a drink? And when I say drink, I mean an alcoholic beverage. So a lot of them are so excited to get the vaccine that they're like, can we celebrate with a glass of wine or with some alcohol before or after? So what is your take on that?
Okay, well, first things first, I think you know full well, there's a new study that came out saying that even 1 glass of alcohol is bad for your brain. There's no safe limit for alcohol, period. So you shouldn't be drinking alcohol anyway. But if you really needed to, I mean, use common sense that the same rules apply. You wouldn't have sedation and drive a car. You wouldn't have alcohol and drive a car. So why would you have alcohol after having a vaccine knowing that you might get side effects? Don't. Just leave it a day or two and then celebrate properly. Because some people when I had my second dose, I was aching all over for a day, literally 24 hours. Some people are fine, but no prediction, no way of predicting. So as blanket, I would say no for now.
No. Okay. I think officially there's no contraindication to alcohol, but like you have rightly mentioned, I mean, I wouldn't want to be drunk or having a hangover if I were to get the vaccine the next day. That's number one. So I would definitely not encourage anybody to have alcohol before the vaccine. And after the vaccine, I think like you rightly said, our side effects may or may not be there for the next 48 to 72 hours. So you don't want to complicate that with having alcohol and you're not sure whether this is because of you drinking or because this is of the side effect of the vaccine. So you're not sure whether to feed into the system as part of an AEFI or a side effect of the vaccine. So thank you for that. And what about supplements? So if they're on probiotics or now there's lots of supplements out there. So should they stop these supplements or should they continue? Or, I know your take on supplements is no need. Healthy diet and exercise is the best, but they're out there.
Yeah, sorry. I'm not anti-supplement kind of person. It's just that take it if you need it. If you're deficient in something, it's proven, then take it. But just don't go buy things because your friends take it. Don't buy it because you think you might be deficient. Prove it, then take it. To be honest, you can get all your minerals, all your nutrients just by eating food. Eat proper food. Don't just treat yourself better than you do, I guess, and you don't need it. So, and you save a fortune. Now, coming back to your question about probiotics, people used to think probiotics are without risk. I'll give you an example. There's a bit off topic. There's been a study to show that if you get probiotics to cure pancreatitis, you cause death. You cause them to die. Now, these probiotics are not without risk. They are bugs, they are things. So if your system is going to be immunosuppressed and things for whatever reason, then probiotics is a bad idea. Though you will never be told this because, you know, we know why. So as it stands for vaccine and probiotics, if you're taking it or not, certainly don't introduce anything. There's no consensus to say whether they're bad or good. I'm against probiotics unless specific indications, and there are very clear specific indications for them. So that's just my point of view as it stands today. It might change in a month's time.
All right, so there's no need to start supplements to boost your immune system to get the vaccine. There's no need to stop or start anything. So that's how we're quite clear on that. But there's no data to say that it actually helps or doesn't help, right?
No, with regards to vaccine. No, I mean the question that you will see, and you will see a lot of these talk shows that say, oh, what's a good diet against COVID? What's a good diet to help with the vaccine and things? Do food really play a part? And no, there isn't anything really out there apart from the standard things that, you know, okay, amla and blueberries, they're high antioxidants, one of the highest, so eat them fresh. But if you have it with milk, you lose all the antioxidant properties. So there's a lot of science that you can use from food, natural stuff. They're cheap, easy to get, that keep you generally healthy. And this has got nothing to do with the COVID. This is stuff that you should be taking normally to be healthy. Do we have all this? Well, we're modern day people, isn't it? So it's too difficult to go and buy raw food and eat it. We just, you know, get everything delivered, made, processed. That's part of our problem, really, isn't it?
Okay, so bringing me to my next question, what about liver transplant? So transplant patients, we do see quite a few here. Can transplant patients get the vaccine?
Yes.
And how soon after their transplant is started?
Okay, so transplant means you're high risk and you are high priority for it. But as it stands in Malaysia, the rule is 3 months. You have to wait 3 months. That's not because the vaccine is probably going to do something. It's more on the lines of letting your disease get under control and you be well. You should be as strong as possible before you go for any vaccination kind of thing. You can get really sick with this vaccine side effects. I don't want to scare anybody, but you can. So the rules are in Malaysia is 3 months. But if you had a liver transplant, you would of course be discussing it with your liver doctor. There's no doubt about it. You have to do that. Please do not rely on the guy giving you the vaccine to decide for you because it's not necessarily their job to decide. So just take steps prior.
Right. So it'll be best to discuss with your liver surgeon or your physician or your hepatologist with regards to how soon and you can get your vaccines. Yeah. It's not difficult to find the information, but I don't want the public to be just, oh, I found something on Google, hence I did that. No, check with your doctor. If your doctor doesn't know, we will say we don't know, and we'll find out and get back to you. And safety first for everything, because things change so fast. You'd be surprised how quickly you're out of date. Yeah, very true. Science changes and we've got to change along with it. Like a lot of people ask us, oh, but this wasn't the same case 2 months ago. Yeah, but 2 months ago the science was different and we've got more data and the science has changed. So I think you're right. So getting your letter or getting a clearance letter from your regular physician would be the best way to go.
I mean,
do you have any last message?
Sorry. I was just going to say the biggest change so far was about vaccines and pregnancy. I mean, it's not my topic, but look how fast that changed from not at all to yes, between 14 and 33 weeks, you must have it. And certain yes and certain no, based on what we have. For inflammatory bowel disease, there are studies that are ongoing, then we'll know more, so kind of watch this space. So with regards to final message for gastro and liver stuff, if you are on immunosuppressive medicines, if you are immunosuppressed, you think your body is weakened or whatnot, you're not sure, come and talk to us. Don't rely on the guy at the door, because out of safety's sake, they'll just turn you away. And it's just that the only difference you may actually need is having your vaccine in a hospital setting, just in case. But beyond that, you should still be having a vaccine. Inflammatory bowel disease, even like we said, liver transplant, you still need the vaccine. Just timing it right, doing it the correct way is the way to go. And as I always say with every one of my talks is that eat more plants. It's good for you.
Find that very interesting. I will definitely take you up on that later on. Yeah, but just to word it a little bit differently. So a lot of people say, I've got this, I've got that, I've got this. Should I get the vaccine? I think we should ask the question another way. I've got this, I've got that, I've got this. What if I get COVID? So it's best if you get the vaccine if you're in the high risk category, whether you've got inflammatory bowel disease, whether you've got something simple like gastritis or any sort of gastro and liver issues. If there's anything that you feel that you're not comfortable about, or if you have some sort of allergic reaction to any of the gastric medications, it'll be good to discuss with your physician about it and decide on a good date. And like you said, the worst case scenario would be you can't go to a vaccination center. You get the vaccine in a hospital setting, which is just deemed a little bit more safer for those who are high risk patients. All right?
Yeah, I mean, you're so right, because inflammatory bowel disease in itself means you're pro-thrombotic. You're more likely to form clots. So does it mean that, oh, you take the vaccine, you're going to get a clot? No. We all know what the risks are for having clots with the vaccine versus having COVID. And you are at higher risk, and if you're high risk by itself, have the vaccine. Why are you taking the risk? I mean, you don't have to believe in it. Just do the research yourself. You will look at the ratios. I think the risk of having a clot with the vaccine is less than having a clot while you fly a plane, and you take flights all over the place, and you never did anything. So just use some common sense, and don't always accept what you get through WhatsApp, because it's a lot of rubbish out there.
Yes, absolutely right. So get the right information from the right people, from the right sources, and always look for something evidence-based, not some auntie sending you WhatsApp messages.
Yeah.
On that note,
finally, of course, what we say now is no replacement for seeing a doctor and having a proper discussion, because this does not cover everybody. Everyone is individual. You need to discuss things unless you're absolutely well, and in that case, just go right ahead. But discuss everything, and this, honestly, we'd rather tell you you're fine than say, oh, now we have to deal with this side effect or this and that. That's just how I apply to all my patients.
So at the end of the day, discuss with your physician if you have any questions or any queries. And if you're worried, just get a letter of clearance. Most doctors know about this letter of clearance. So if you're worried about anything, just get a letter of clearance, so you don't have to let the doctors at the vaccination center make the decision, and you don't want to be turned away from the vaccination center. So I think on that note, thank you so much, Dr. Prabhjot. If there's anything else anybody else has to ask, please DM us and I will get back to you online. So I'd just like to end this by saying that I'll be having my next live session tomorrow with Dr. Yiki. We'll be talking about masking. Should we be masking our kids? Should we be masking ourselves? What sort of mask? So join me live tomorrow, and I'll see you then. Thank you so much, Dr. Prabhjot. Bye.
All right, thanks for having me. Bye. Bye.